Good afternoon and welcome to our webinar on the traumatic brain injury among children and youth, Understanding TBI and One Model State program. Our event is sponsored by the Children's Safety Network, and I'm your moderator, Kristen Teipel, the Director of the State Adolescent Health Resource Center at the University of Minnesota, a partner in the Adolescent and Young Adult Health National Resource Center, and an active member in the Children's Safety Network Alliance. So our project is supported by HRSA, which is a part of the U.S. Department of Health and Human Services under the Child and Adolescent Injury and Violence Prevention Resource Center's Cooperative Agreement. This information or content and conclusions are those of the author and should not be construed as the official policy or position, nor should any endorsements be inferred by HRSA, HHS, or the U.S. government. Before I introduce our two speakers, my colleague Rebecca Wilmer has a few technical announcements. Rebecca?
Thanks, Kristen. Audio is being broadcast through computer speakers. The quality of the audio depends on the speed of your internet connection. If your audio is choppy, please find a more stable internet connection or listen over the phone by calling 866-835-7973, the number you see in the top left box. If you're listening through the phone, please mute your computer speakers to eliminate echo. Phone lines will be muted during the presentation to eliminate background noise. Answers to frequently asked questions are in the webinar instructions pod in the upper left. If you have questions or technical issues, please type them into the Q&A box on the bottom left at any time. And after the presentation, we will pause for the presenters to answer your questions. We also have a PDF of the slides available to download above the slide deck. Click on PDF of slides and then select the Download Files button to save the document to your computer. This webinar will be recorded and the archive will be sent out to all registrants within 2 weeks. Thanks for joining us, and back to you, Kristen.
Thanks, Rebecca. So on to presenting our two speakers. We have two wonderful people talking with us today. Our first speaker is Diane Sartanowicz, who's been active in the athletic training profession since 1991. She currently directs the Massachusetts Concussion Management Coalition, where she oversees the creation of concussion education and management at the state level. She also collaborates with key stakeholders in the Commonwealth to provide schools with the tools and resources they need to successfully address and manage concussions. Diane has been actively involved in various volunteer professional opportunities at the state, district, and national levels, including President of the Athletic Trainers of Massachusetts, past President of the Eastern Athletic Trainers Association, District 1 Treasurer, and National Athletic Trainers Association District 1 Director. Our second speaker, Terry Love, is a community leader with over 20 years in community-based prevention. He's worked in multiple settings to develop leaders and motivate stakeholders to facilitate population-level change in school, university, and statewide settings. He uses data, evidence-based methods, and policies to help communities identify and mitigate the root causes of behavioral health problems, including motor vehicle injury, substance abuse, premature birth, and other health issues. Terry enjoys the process of influencing policy and sharing his knowledge of advocacy with others. As a native Arkansan, Terry recently adopted Middle Tennessee as his home. That's where he works as the Injury Prevention Manager for the Tennessee Department of Health, with a goal to impact multiple injuries, such as motor vehicle crashes, traumatic brain injury, suicide, and intimate partner violence. So Diane, I turn the floor to you.
Great. Thank you very much for having me be a part of this webinar. I hope to give everyone a broad overview around TBIs and concussions and hopefully lay the groundwork for further discussion on this topic. And so my objectives for this presentation is to talk about TBIs and concussions. But first we need to have a starting point. So how do we define a concussion? How do we diagnose the injury? And what does our examination, testing, or imaging look like? What's the prognosis and outcomes of this type of injury? And then I'd like to quickly set up our next speaker who will give you a more detailed presentation on how to prevent concussions and TBIs. So here on this slide, I'd like to show you some statistics from the CDC. As you can see, TBIs represent 30% of all injury in deaths. And every day, over 150 people in the U.S. die from injuries that do include a TBI. Most of those TBIs are mild concussions. So when we talk about concussions, we will also use the terminology MTBI. And up to 13% of patients with concussions will suffer post-concussive syndrome or will continue to suffer some symptoms later on in life. This slide shows you the number of emergency room visits and hospitalizations that occurred in 2013. These figures show you just the extent of the injury and the overall burden that it can present on our health system. So the question we need to ask ourselves is whether the emergency room is truly the best place to manage an injury like an MTBI or a concussion. Or can we do a better job out at those schools and institutions with educational programming and having the right healthcare providers in those places? As you can see, it's not just sports-related TBIs, but when we do discuss concussions, it's mainly focused around sports and physical activity. Here in the pie chart, you can see that the main cause of TBIs is falls related. So how do we define a concussion? Well, the experts in concussion education and research get together every 2 years, and the last one was in Berlin in April in 2017, and they come up with a consensus statement on concussion in sport. And here they define a concussion as a traumatic brain injury induced by biomechanical forces. Well, that's pretty broad. And as we know, we can have a direct impact to our skull or head or face, or those impulsive forces. That means it can be an indirect hit, like a whiplash event or falling hard on the ground. And usually those neurological impairments that we suffer from will resolve, but they are spontaneous. They start right away, but unfortunately some may develop over time or be delayed. Okay? Concussions are a result of the brain's function. It is a functional injury. It's not a structural injury. And I'll talk more on imaging. So this is why when we have x-rays and CT scans that they will become normal, because we're talking about the function of the brain and not the structure of the skull. We also know that through the range of these clinical signs and symptoms, we may or may not have involvement in a loss of consciousness. So how do we diagnose a concussion? It can be very difficult, but we actually have 3 main scenarios. The first one is often easy to identify. We take, for example, a football game and a player gets tackled and they get up and they struggle with their balance to come off the field, and we can immediately see that. But many others are much more difficult. Those are those smaller hits, multiple hits that we don't see. They continue to play the game. They don't exhibit any signs or symptoms of an MTBI. Or we also have that football player who finishes the game and has a great game, and then all of a sudden at home exhibits some of those symptoms. So that's where those are delayed. But truly the most difficult scenario that we have is when we have a patient come to us with a whole set of new symptoms, and they can't really pinpoint why they have these symptoms or how they got these symptoms. And so what we're trying to do is to assign that injury. We need to keep in mind that when we diagnose an MTBI like a concussion, that it is a rule-out diagnosis, that we're trying to figure out that it can't be anything else structurally, that it has to be something functionally. So part of our test as an athletic trainer, as a sideline assessment, we use something called the SCAT-5, and I hope the folks on this webinar are familiar with this. And it has a few steps to it. This is an open source resource that you can find. We also share this information with athletic coaches as well. But the first step is to identify our red flags. And if we have any of these red flags, then we want to call our emergency medical system, our 911, for that student athlete. And then our next step are those observable signs that we witnessed or that we observed. And then we're going to ask our athlete a series of questions, somatics questions, that relate to how their brain is functioning, memory and recall. And then as we continue on this assessment, we have a Glasgow Coma Scale, and hopefully if you know on a sideline with a Glasgow Coma Scale, this is actually an emergency room scale, so hopefully they are responsive and they are verbal to you. Again, this goes back to some of our red flags. And then what's really important in our assessment is the cervical spine, because we also want to make sure that we rule out any injuries to that area. Another test that we have is something called the BESS test, or our balance error scoring system. And here on these pictures, what you can see is I also put modified BESS, meaning the pictures at the top are being done on a firm surface, like out on a playing field, and then the pictures on the bottom are done on a foam square, okay? We don't usually bring that foam square out to a soccer field or a basketball court. And we're asking the athlete, testing their balance, we're asking them to close their eyes, to perform these three stances, double leg, single leg, and tandem, and we're checking for our errors. Because as we know, in a head injury like a concussion, their balance can be affected. The next test that we have as a clinician is something called the VOMS test, a vestibular ocular motor screening test. Again, we know that those two systems can be affected when it comes to a concussion. And here the pictures are showing us how to perform the test. And then we're also recording the symptoms if the student athlete has a headache, dizziness, nausea, and fogginess in relationship to that test. So our examination. There's a lot that goes into diagnosing an MTBI. And it's not just on the sideline, but also in the athletic training room or even in a physician's office. So here I put together an exam that we're looking at the impact site for any local trauma. We're also getting an assessment of how that patient is reactive to us, their mood, their speech patterns. Again, we need to rule out the cervical spine and do an evaluation in that area. We have a neurological exam that we do. And we come to a conclusion, to be honest with you, that most of these will be completely normal. And so again, then how do we truly define and diagnose a concussion? We also rely heavily on the subjectiveness of what our patient is telling us. So here on the slide that I'm showing you is our symptom cluster scores. And from here we can gather a good starting point for how we're going to manage the injury, or more importantly, what academic accommodations they may need to provide them with help when they go back into school. So with all that we know, how do we manage an MTBI like a concussion? There is a difference between putting the student athlete in danger and versus how they feel. I have worked with several clinicians and physicians, and I've kind of taken this theme that they continue to say is, we're gonna do it like we treat grandma, almost like we treat the elderly. Under that, you will see these are good, healthy habits that we should all be doing. Some of the symptoms of a concussion, like a headache or feeling fatigued, they might be feeling this because they haven't had enough fluids or their sleep pattern is different. Okay? But when we manage a concussion, there are 3 central principles that we always need to keep in mind. We want to prevent a new injury from occurring. We want to minimize any school interruptions, so that's where our academic accommodations come into play. And we also want to prevent deconditioning. And always keep in mind that it's not just physical conditioning, it's also their social well-being as well as their psychological conditioning. So as I mentioned earlier, the use of imaging is uncommon when we talk about concussions because it is a function of the brain and not a structural finding. X-rays and CAT scans are very good when it comes to finding skull fractures or bleeds like hemorrhages. Okay? We will do a CT scan if we have an obvious loss of consciousness at the time of the injury or if they are exhibiting any neurological deficits. There's some research and studies out there by some clinicians that functional MRIs may be used with prolonged symptoms, those that last over 4 weeks or into a month. We also have another resource available to us, impact testing. Again, I hope the folks on the webinar are familiar with this. Impact is a company that provides a neurocognitive testing as it relates to baseline and brain functioning. The picture that you see is the one that we are all familiar with, the sport online version for 12 years old and older. They do have a pediatric impact application tool for 5 to 11 years old that are done on an iPad one-on-one with the clinician. But we need to keep in mind that using this as a tool, as a clinician, it's just one tool in our multiple toolbox. And so it is not a standalone test, and it does not diagnose or clear on its own. Okay? They do have some significant limitations when it comes to performing a baseline. As you can see in the picture, as an athletic trainer, I have 10 adolescent football players all in a room, and I'm asking them to be on their best behavior for the next 25 to 30 minutes and to really concentrate on this test. But it is a good tool, again, to use as a clinician when we are trying to return an athlete back into physical activity and sports. And so what's our prognosis? The CDC came out with their guidelines on diagnosis and management of MTBIs among children. And what I have done on this slide is giving you the positive numbers. So as an example, 70% will recover in a month. 90% will recover in 3 months. We want to talk positively in these outcomes. What you will see in the CDC's report is 30% will still suffer in 1 month. And so I think it's important as we have these student athletes and these patients of ours is to really highlight the positive that an MTBI like a concussion is a rehabilitative injury, and that the prognosis and the outcome is really, really good for them. At the bottom, there are some predictors that we have. We know that those folks are going to have a longer recovery if they have a history of previous concussions, if they were diagnosed with a learning disability, have a family history of headaches or migraines. But most importantly to keep in mind is this their worst symptom that they tell you, they describe being in a fog. And so we want our athletes to understand what that is like so that we can treat them right away. We know that that cognitive symptom of fogginess, if they have that their recovery is going to take longer. There's been several studies out, this one in particular. We know about repeat concussions, that if you've had one concussion, then you're 1.5 times more at risk for a repeat concussion. If you have two, you're 2.8% at risk, and it gets higher and higher. And so we always ask the question, even to this day, is how many is too many? We really don't know this answer, and we need to keep on continuing to find out with research and with some data. Some recommend that if you have 2 MTBIs or concussions in the same season, that you're done for that season. But to be honest with you, it takes a multidisciplinary team approach. It takes great communication amongst those folks, and it varies based on the patient age, the level of sport participation, what does the future bring, and we have to have an acceptance of some risks. So we know that playing a collision sport like football has a higher risk to it. But more importantly, our decision needs to be based on how that patient, their pattern and their evidence of how they recovered and the effects of that. And so I won't speak a lot on prevention, but I hope to set up our next speaker who will address in more detail this issue. But how do we prevent a concussion? The most important thing we can do is be aware of the incoming injury. And a sport like football, we don't want to have any blindsided tackles. And so obviously there are rules against that. But if we are aware of that oncoming tackle, then we can guard and we can brace our body for it. Cervical size and strength also is a factor. We know that females have a smaller cervical neck, as well as the musculature strength around their neck, but we can do some simple exercises to help in that respect. And then protective gear. At this point, we really don't have any research out there that a helmet, a headband in soccer, or mouth guards will prevent a concussion. We do want to emphasize that protective gear helps for other injuries, and we want to encourage all physically active individuals to wear properly fitting equipment, whether it's a bike helmet, a ski helmet, or shin guards in soccer. So I can share my resources with everybody. I'd like to thank you all very much for allowing me the opportunity to present to you today. And I'd like to pass the mic on over to Terry.
Thank you. This is Terry Love. Hopefully everybody can hear me okay. I wanted to share with you some work that Tennessee is doing in primary prevention of TBI and other issues, injury issues. First of all, I need to make sure that proper credit is given. This is not a program that I developed personally. I'm part of the team that works to promote the program. Rachel Heitman, who is the injury section chief here at the Tennessee Department of Health, whose contact information will be at the end of this presentation, had a great role in the development of this program, along with Dr. Alex Diamond at Vanderbilt. So I want to give credit to both Rachel and Alex, and hopefully as I share this, you can have some questions, and we would love to have you contact us and let us share with you how to perhaps spread this program to your state. The Safe Starts program is a safety recognition program for all youth sports organizations. Originally was developed for community sports organizations, and we've since migrated that over to include school sports. It is a collaboration between us at the Department of Health and the program for injury prevention at youth sports at Monroe Carroll Jr. Children's Hospital at Vanderbilt. It's a mouthful. That's the one that Dr. Diamond, Alex Diamond, leads. And this is a free program sponsored by the Department of Health, and it's voluntary for schools at this time. And what we try to do is award gold, silver, or bronze designation to the schools. So why do Safe Stars? And some of these statistics you probably already know. We know that a large number of children and adolescents participate in youth sports in the United States, and we want to encourage that. And we know that more than 2.6 million children are treated in the ER for sports and recreation-related injuries. Not all of those are traumatic brain injuries, but and they're about, in Tennessee, we have about 35,000 youth sports-related ED visits each year. So, and we know that these injuries are largely preventable. Some concussion statistics, again, you may already know this data, but we know that concussion is a problem in youth sports, and the brain injuries that result from those concussions are cause difficulty for youth and families. And we know that the head is involved in more baseball injuries than any other sport. So we have a lot of head injuries in sports. We also recognize in Tennessee that sudden cardiac death was an issue in our sports program. So as I talk about these other injury issues, you'll see that the Safe Stars program is much broader than just traumatic brain injury. So when we decided to reward schools, it's really wanting to have a comprehensive injury prevention program. But sudden cardiac death is an issue in Tennessee and across the country. And so there's been a great push in our state to try to reduce that. Also, we know that if without AEDs and without training, survival rates decrease without defibrillation, and we have specific incidents in Tennessee where we've had lives saved because of good training, emergency planning, and defibrillators that were available quickly. And again, all this is kind of tied together in the Safe Stars reward program. We try to encourage emergency action planning at the schools, and we want clear and detailed emergency action plans that are practiced regularly, and we want to make sure that our coaches and leaders understand those plans and use those plans. That would include an allergy plan, and you can see there the image. You may or may not be able to read it, but it's the sample emergency action plan for anaphylactic shock. And so on our website, we provide all the resources for these plans, very detailed information, links for sports organizations to have model policies. Severe weather is also an issue in sports, and the CDC has found that there were about an average of 9,000 cases of heat illness. So between heat and lightning, those are other two big issues for sports management, injury management, and we included that in the Safe Stars scoring as well. And this was kind of a last minute addition to the Safe Stars program, but some of the programs in Europe were including what's called a safeguarding policy, and for us that would be a child abuse and neglect policy. And we know that coaches have great relationships with their players, and they may at times hear and see things that other teachers may not. So we included that in the Safe Stars evaluation as well. And so that's part of our program. And the other thing that I mentioned once before is we want to make sure that our students are participating. Tennessee has a very high rate of childhood obesity. We're above the national average with overweight and obesity. So we do not want to discourage sports at all. In fact, we want to partner with sports organizations to help them increase activity, physical activity, and make that part of children's lives. We just want to make it safe and safer. So that's kind of the overall goal of the Safe Stars program, is to increase activity, increase safe activity. So how do organizations become recognized? Well, we've set up a criteria list for organizations and school athletic programs to be rewarded bronze, which is the entry level. And I will say I think the bronze level is a pretty high bar especially for sports organizations that are not attached to schools. When we first got these criteria and we started recruiting these sports organizations, we just kind of a lot of experts sitting around the table, and we thought, well, this should be great. This should be easy to do. And we started approaching these leagues, and we found that this is a pretty high bar for them to have all of this in a volunteer type small sports league, in a small town in Tennessee. So we've had some challenges around this, but we've kind of held to this because we felt like these were very important key pieces. And so at this time, we're still holding to wanting our entry-level teams to have at least all of these criteria met before they are recognized in our program. To get silver or gold level, they have to meet all the bronze level criteria and then get 2 or 4 of these additional criteria. For example, if go back to the bronze level. So let's say, for example, our Nashville Soccer League, meeting all of these, they provided us all of these different policies, these plans, and they've got it all in a neat package. They send it to us. In order to get silver or gold, they have to also do 2 or 4 of these in order to get silver or gold. And so having a medical professional on site for all games or all practices, or provide risk and safety information policies to parents and guardians. And what we're finding is that the teams that can achieve bronze, the teams and or organizations typically go on to achieve gold status. So here's some examples. One good example of going above and beyond bronze would be to do something like the Coaching Boys and the Men program, which we promote through our core SVIP, States Violence and Injury Prevention Program grant from the CDC. The Coaching Boys and the Men program would be a program where the male coaches teach male athletes appropriate, behavior towards women and girls. Or other kind of examples would be extra training or nutrition, hydration education. If they can document those things and show that they've done those things, then we can recognize them as the silver or gold level. So how do schools apply? It's all online, and hopefully after this presentation, you can Google Safe Stars Initiative Tennessee and go online and look at our website. You can go and I don't want you to go right now because you'll get distracted from the webinar, but you can go and download the actual application, and we provide that to them so they can see what the paper pencil application looks like. But the application is actually done online, and we walk through with the organizations to help them apply. They have to upload their information online, or we can assist them to do that. And we found that we've had to do that with some of our local groups because, they're run by volunteers or maybe one staff member, and they need the help with the web uploading and policies and that sort of thing. The recognition is valid for 5 years, and they are provided resources and consulting and help from us that whole time. What are the benefits for the league? Well, the biggest benefit is being recognized in the state, and they get a signed certificate. They're allowed to use the graphic that you see below, and then they're recognized on our website at this time. And there are other benefits. We do at this time have a limited number of AEDs to provide to organizations that do not currently have an AED and they need that AED to get recognized. We have found some funds to purchase a limited number of AEDs for them. And I want to talk a little bit about our partners. One of the things, I don't know how it is in other states, but we could not really do anything without partners. We don't have enough staff, and so what we do is we recruit partners to help us promote and support the program. And you can see there we have a number of partners and a number of different organizations, and I have a list later to share with you. But at this time, one of our major partners is our TBI program and the Traumatic Brain Injury Program, and Jean Doster runs that program for Tennessee and has for many years. And she's actually in our section, so we're co-workers, and we work very closely together. and they have been super supportive of the program, even though the TBI program is mainly focused around treatment and not prevention, but they recognize the need for prevention. And so we partner with them, and then part of our goals to prevent sports injury are included in our core grant, and so we are providing support to each other, and we have resources available through the TBI program to schools. In fact, we disseminated, I want to say, how many thousand of the, I'm looking at Gene, strategies from the CDC. I mean, we disseminated the best practice return to play policy. We printed and disseminated those through the Tennessee Secondary School Sports Association, TSSAA, to all coaches in the state. So every coach got a copy of this return to learn, return to play concussion management guideline document, which you can also Google and download if you would like to see a copy of what we have. And we have been surveying our coaches annually for 2 years. We're going to survey. I just sent out a survey again today through the TSSAA, who's a major partner. We survey a random sample of all Tennessee secondary school coaches to see how they're adhering to these guidelines, or their knowledge about concussion, and if that's changing based on some of our education. Here's some of our Safe Starts partners. You can see just about everybody that's anybody in Tennessee around this issue is a partner, is signed on as a partner. All the professional teams, except for the Titans for some reason, the Nashville NFL Titan teams has not signed on yet, and we're still working with them. But all the other professional organizations, sports organizations, and then you can see the family physicians, the emergency care alliance, medical associations, nurse association, just about a who's who list of everybody who would touch this issue has signed on. And how are we doing? I wish I could tell you that there's 1,500 teams that are doing this. That is not the case. We have worked very hard to promote it, and we've had about 70 people who've contacted us through the website or through other means. About 50 of those folks, we followed up with them and had follow-up contact with them. And then about 32 folks have started an application. In the beginning, we were recruiting heavily sports organizations outside of schools, and then over the last, just in the last 6 months, things are really starting to pick up. So we have 14 schools now that have completed the application, and we have 4 leagues that have completed the application. So you can see, and this, if you ever looked at a sales funnel, you ever seen that graphic? This is pretty normal. We have that many contacts, and to have, I don't know if I have a pointer, but if you could, if you could see, like, these two are actually, all of these are recognized as gold level. So it's interesting that the schools or the organizations who did it were recognized as gold level from the very beginning. And here's those organizations to date, and we just got another application turned in today from a small school. But you can see that a few recreation centers, a couple of private organizations, the lacrosse and the soccer club, but our high schools are starting to come on board, and we are finding that the Tennessee Trainers Association has been very supportive, and we actually presented at their state conference recently on Safe Stars, and I will be presenting at their regional conferences because Tennessee has 3 different regions, and they each have a association presence, and so I'll present to each one of those as well. So we continue to promote Safe Stars. We've had some success, and we've had some challenges. I think the greatest success we've had is that we have tremendous partner support. We had a huge kickoff of media, and NPR did a piece, and a lot of news stations covered it, and we have the infrastructure in place now. We think our webpage has been updated enough and tweaked enough, and we've secured resources for AEDs. And again, we're working with close kind of targeted partners. The challenges is that these, and if you try to do this in your state, be aware that your volunteer leagues, this may be intimidating for them. And as you go to our website, you may even yourself look at it and go, this is a pretty big deal. The application itself is not complicated. I think what's complicated is that when you're asking folks to have not perfect, but model policies, and then have those all in one package in one place, that it's difficult for these leagues to do that. They may not either they don't have policies, or they don't know where they are, or they get busy. They start an application, and then the season starts, and they're all volunteers, so nobody's there to kind of do the paperwork work. That's been a challenge. And the other thing is that we thought that when we got AEDs, that would be a great incentive for organizations, and we're not sure that they even understand the need for the AEDs at this time. So we've got some work to do on awareness. We've got some work to do. Maybe I've even thought about possibility of creating a policy book that just has every model policy. All they have to do is put their names and, something very, very simple. But that may not be a one-size-fits-all, may not be perfect. So, but anyway, and there has been some legal concerns when we sent the application to schools. Then they had their lawyer look at it, and then there was some words about indemnity and, if we sign this, are we legally, so that may also be a concern for folks. But we got those worked out. But those are challenges that we've had, and then just staff time, and it would be nice if we had some other incentives to provide to leagues and schools to do it. But budgets are tight, and that's kind of where we are. But all in all, a great program. We're very proud of it. We think it is a program that could be replicated around the country, and we'd be willing to talk with you, and maybe you could build on what we have done. And I will. Our future plans, just continue to work with the TBI program, continue to work with Tennessee Trainers Association, and continue to try to break down barriers. And then we have instituted some work, some process to evaluate the program, but we need more applicants so we can see how that's working. But process evaluation is going on all the time. Why we're talking about why it's working, why it's not, how do we tweak it. But the outcome evaluation, I think, will have to take some time, and we need some more applicants and some more recognized leagues for that. But anyway, hopefully I'm not under time or not over time, so we'll have plenty of time for questions. Thanks again for letting us present. There's my contact information. If you want to contact me, you can email me. My name is Terry, so if you call me, you can call me Terry. Or you can contact Rachel. Some of you may know her, and we'd be glad to answer your questions directly, share our materials, or help you get started in your state.
Wow, Terry and Diane, this is your moderator, Kristen, just saying, wow, my brain's spinning with all the great information and insights you've just shared with us. So thank you very much. I know many of you have questions at this point in time and are wanting to get those questions answered. So right now, why don't you type them into the Q&A box on the left bottom part of your screen, and we'll get going with a few that have already come in. So Sonia asks you, Terry, about is SafeStars for both private and public schools?
Yes, it's for any sports organization, youth sports organization in Tennessee. So we've marketed the program to public schools, private schools, any youth organization, sports organization that we could find, really, we've marketed to, and it's available to all.
Great, thank you. And Diane, Cindy asks, please address your return to school approach. Terry, are you muted?
No, I'm sorry.
Oh, I'm sorry, Diane. Diane,
Yeah.
Sorry. Confusing my presenters today. Diane, can you talk about the return to school approach? Terry, then I'm going to bring us back to you. Do organizations have incentives for applying to be a Safe Start program? I think you talked a bit about that.
In the beginning, we really didn't have incentives other than just the recognition, and I think we were a little bit, I don't know if the word's arrogant, but I think we thought, wow, recognition from the health department, that those schools will want that and parents will want that, and it just didn't, may not be just enough in and of itself. And so then we decided to look for the AED because we thought the AED was a barrier. What we're finding is that's not as big of a barrier as we thought. So we may have to be more creative and find more incentives for, especially the leagues. The schools, I think, are going to come around. Most schools are following a lot of these policies and practices already, or I say most, many are. And so for them, it's just a matter of pulling all their policies together and to make an application. It's a little bit easier. Even that's hard, though, because it's something extra for a school person to do. So I would encourage, and if people have ideas for incentives, I'd be open to hearing about them.
Great, and let's keep asking you one more question, Terry. Kim asks if there are standard policies already written and available for free of charge, which you did talk about the idea of a gathering of policies. But can you talk a little bit more about like where you might want to go with that?
Well, if you go to the website, after we're done, just Google TN Safe Stars, and you can see we've collected all of model policies from different organizations, national organizations, and so a school can actually go, any school could go to the website and create excellent policies now. But there's not a one-size-fits-all little policy handbook that we could hand an organization yet. So, but beginning to talk about that to see if that's a possibility, especially for those like a neighborhood soccer league or a small town baseball league, or they need that almost plug and play. It seems to me they need almost a plug and play use of a policy handbook, but that's a little ways off for us probably.
And one more question for you. Have other states, or what other states have implemented Safe Stars?
We're not aware of anybody else doing the program as it is. We've had some contact with other states who are interested, but we're not aware of any other state doing it yet.
Okay. Oh, maverick state that you are. Wonderful. Diane, are you able to take some questions?
Yes. Can you hear me now?
Yes, we can. Perfect.
Oh, sorry. Thank you.
No problem. So the question is, do you use the CDC guidelines for schools to check for concussions, or do you have your own checklist?
That's a great question, and it depends individually on the schools and what their resources and also their personnel that are out in those places have. We kind of use a hybrid of all of them.
Great. And another question for you from Holly. What do you feel is a school nurse's role in concussion management?
Oh, to be honest with you, the school nurse is really a key piece of the concussion management team. School nurses, athletic trainers, even the athletic office, working with the athletic director, they all play integral roles. And we encourage a school to have and to set up within their protocols a concussion management team that should also consist of maybe guidance counselors and advisors within the school, so that the student athlete who is recovering from the injury, we put in some accommodations for them when they are returning back into the school setting.
Thank you. So Diane, we're going to continue with you. Kim asks, how does the prevent decondition work school-wise when screen time is to be limited and most schools use computers throughout the student's day?
Yeah, that's a good question. So we need to keep in mind that an injury like a concussion
is not going to have a cookie-cutter approach. And so what I mean by that is concussions are like snowflakes or fingerprints, and we can't treat them all the same. So how one student athlete is recovering from an injury is going to be different from another one. Okay, what we have found with research right now is that we can do some what we call symptom-limited or symptom-limiting activities. So we hear a lot that we don't want to do anything and we want to rest after a concussion. But to be honest with you, our research right now is showing us that we should be doing a little bit of light activity, like walking your dog, cleaning your room. I hear this a lot from parents. Okay, but we do want to have them to be active. It's really a matter of, and that picture that I showed about, we don't want to put them in danger or in harm's way. That doesn't mean I want them to go back into a sport-related activity, but I do want them to be active at a monitored and observable place. And having an athletic trainer to observe and to keep track of their symptoms and that injury is really beneficial when it comes to recovering.
Thanks, Diane. And Terry, we're going to move back to you this time. There's a question from Kristen about suggestions for marketing to those sports teams and schools about applying for your program, and are there any marketing strategies you have for overcoming their challenges of getting going? Because sometimes schools say they have so much on their plates, and as you mentioned, the volunteer sports teams are overwhelmed.
We've noticed, I've noticed over the years in my career, when you used to work with schools, they were eager to work with you, and kind of embraced new ideas and kind of innovative programs. And I'm not saying our schools aren't doing that, but I think on average they're so covered up with required activities, and there's so much pressure for test scores to be up. That's part of the challenge with schools. But one of the ways we found to work is if you work closely with your local athletic or your state athletic association, get their endorsement, because these athletic teams, while they don't actually report or answer to the athletic association, they strongly want to be a part of it and a successful part of it, because that's kind of how they are judged with their success or not in their tournaments, and they have requirements. So getting that partnership is key. And Mark Reeves at the Tennessee organization, TSSAA, has been wonderful to support us, and we were able to partner with them and be on their one of their medical safety committees, and also partnering with the Trainers Association has been helpful. It's really about relationships and partnerships, and then getting that marketing coming from the people that they already know and respect. That's helped us some. We still have a ways to go, and part of that's just manpower and spread of information, and so we're continuing to work on that.
Definitely complicated. Terry, I'm going to keep you with one more question here. Nancy asks about creativity with incentives and asks if you've asked the organizations about ideas that would be effective incentives for them. And a related kind of question is outreach to parents requesting or demanding or looking for the certification process with your program.
Yeah, that's a good point. Yeah, that's a good point. And a group that I think we probably could reach out to, and I have on another issue, is the Tennessee Parent-Teacher Association and your Parent-Teacher Association groups, to make them aware of this, and so that there's, so that those parent groups are asking for this as well. That's a great point. As far as the incentives for schools and organizations, we have not, to my knowledge, I don't think we've surveyed. I'm looking at Gene. I don't think we've surveyed them to ask what would incentivize them. And that would be a good idea. One of our issues is we really don't have any funding for this program. We're kind of doing this kind of by the seat of our pants. So if I got a lot of great ideas, I might not be able to meet them. That doesn't mean I shouldn't ask, though.
Thank you. So Diane, question back to you. Monica asks if you can specify on the return to school following a concussion that some neurologists don't specify stipulations upon returning to school. Should TV or computer screen time be limited?
Yeah, so again, it's going to be on an individual basis, and it's really a function of good communication between that physician with the school, with the athletic trainer that's there and the school nurse for those accommodations. We have developed over the years, again, sort of a hybrid checkoff list of accommodations. And so specifically parents always ask this. And sometimes even the student athletes fear that if you take away their cell phones so that they can't, text their friends and they can't play computer games, you've kind of rocked their social world in that. Okay, so what we try to do is to have those accommodations in place with small amounts of time. And so when we start off, and I guess I'll call them levels or stages, is that it is okay to be on the computer or on your phone, let's say for 5 minutes. But then that's it, okay? If they have any symptoms that get exacerbated, like if their headache increases or they're having some vestibular issues, then we want to stop that activity. Okay, I work with several physicians who talk in terms of bumping up against symptoms. And so what that means is, again, those small chunks of time that it's okay to do that activity, but you don't want to increase those symptoms. So once when you're feeling a headache or having some vision issues, then you need to stop. And then the next stage, that probably might be the next day, then we can increase that time to, say, 10 minutes of the screen time or activity.
We have time, thank you. We have time for one more question, maybe two here. So, Diane, I'm going to stay with you for one more here. Robin asks, do you have any experience with a recent publication promoting aerobic exercise for returning to function?
Yes. Thank you for bringing that up. So it's research being done out of Buffalo by Dr. John Leddy. And again, it's going back to where the old way of thinking was in terms of resting, doing nothing. And usually in schools we see these notes from physicians that say, do nothing for 2 weeks. Well, again, it goes back to that deconditioning of physical deconditioning. You've taken away the social environment of the student athlete being on a team, and we also, psychologically, that plays a factor as well. So the research that is being done is saying that we can do some physical activity, but again, it has to be in a controlled environment. It should be observed and monitored. And to get them, we can have complete rest for the first day or two, or 24 to 48 hours. But after that, it is okay to do some light activity. We usually want to get an athlete on a stationary bike so that their head is not bouncing, or walking on a treadmill, and that's some of the research that has been out there. So it benefits, again, going back to that, treating grandma, it just benefits our body to get some light activity going.
Thank you. And Terry, I'm going to give you this last one in case you can do this in a minute. John asks about outreach to elementary and middle school to get them involved in your program. Can you talk about that quickly?
We've just really begun the hard start with schools, and so we focus mainly on high schools at this point. I'm sure as we move along, and I want to say we have some middle schools. It's going to be district by district, and they may decide to do all athletic programs. I don't know yet about elementary schools. Honestly, I just don't know the answer to that. But, I mean, we're open to discussing it with any group that has organized sports activities and can meet the criteria.
Great. Thank you so much. Thank you, Diane and Terry. Thank you to Children's Safety Network for this wonderful opportunity here. And thank you to you participants for being here today to be concerned and interested and involved in making sure all our young people are safe. So we're calling this webinar to a close, and I ask you to complete a quick evaluation of today's session. You can see the link here on the slide before you go. So again, thank you, and enjoy the rest of your afternoon.
Thank you very much.